All right, get ready, because today we're going deep on something really important if you've had a kidney transplant or are thinking about getting one.
Oh, yeah, this is big.
It's all about what happens to your bones and minerals after you get that new kidney.
It might not be the first thing you think about.
Right. But it's crucial for your long-term health.
Totally. We're going to be using this super in-depth medical text to help guide us through all this.
I gotta say, the thing that really got me hooked is this weird paradox.
Uh-oh, what's that?
Well, obviously, a kidney transplant is a huge positive step,
Yeah,
right?
sure.
But sometimes it can actually lead to new problems with your bones and minerals.
Interesting, yeah.
It's like you get this fresh start, but then there are these hidden challenges to bone health that we really need to understand.
It really is fascinating how all these different factors come into play after a transplant.
So let's start with the basics.
Okay, so chronic kidney disease,
Oh boy.
it really messes with your mineral balance.
In what way?
Think about it like this. You've got phosphate retention, your parathyroid glands going into overdrive, and not enough vitamin D.
Wow, that's a lot going on.
It is. And on top of all that, you can even get a buildup of things like beta-2 microglobulin and aluminum.
Okay, I'm gonna need you to break that down a little.
Sure thing.
All those big words, what do they actually mean for your body?
All right, well, imagine your body is like this perfectly tuned orchestra.
I like that.
And each of those minerals and hormones we talked about, they're the musicians.
Okay, I'm following.
So then chronic kidney disease comes along, and it's like someone let a bunch of toddlers loose on stage.
Oh no, pure chaos.
Exactly. The kidneys, which normally filter all the waste and keep things in check, they can't do their job properly.
So things start to fall apart.
Yeah, for example, phosphate starts building up because the kidneys can't get rid of it efficiently.
Oh, that can't be good.
And then your parathyroid glands, these tiny but powerful glands in your neck, they're like, hold on, we got to fix this.
They try to take charge.
Exactly, and they release parathyroid hormone, or PTH, which pulls calcium from your bones to try and restore that balance.
So they're like the overprotective parents of the body, trying to maintain order even if it means causing a little trouble.
I love that analogy. That's a great way to put it.
But like, too much of a good thing can be bad, right? So too much PTH for too long, that can't be good for your bones.
You're absolutely right. It can actually weaken them.
Yikes.
And as if that wasn't enough, the kidneys also struggle to activate vitamin D, which is crucial for absorbing calcium.
Like a domino effect.
Totally. It's a recipe for bone problems.
Okay, so we've got phosphate problems, calcium problems, vitamin D problems.
You got it.
Chronic kidney disease is really messing things up.
It is. And you remember those other two substances we talked about, beta-2 microglobulin and aluminum?
Yeah, the rogue players.
Well, they cause even more disruption.
How so?
Beta-2 microglobulin is a protein that builds up in your blood because, again, those kidneys aren't filtering it out. And it can actually form these harmful deposits, especially in your joints.
That sounds painful.
It can be.
And aluminum.
Well, it's not just in your kitchen foil.
Right.
It can build up in people with kidney problems and actually soften your bones, which is called osteomalacia.
Okay, so we're painting a pretty grim picture here.
I know it sounds bad, but there's hope.
Oh, good.
Because that's where a kidney transplant comes in, like a hero to save the day.
Thank goodness.
It's a total game changer.
How so?
Well, it starts to reverse a lot of these problems.
Like what?
Well, that new kidney filters out waste like it's supposed to.
Okay, that's what we want.
Phosphate levels start to go down, PTH decreases, there's less bone breakdown.
That's amazing.
Even those soft tissue calcifications we talked about, they start to improve.
So, happy ending. Everything goes back to normal.
Well, not quite.
Oh,
It's not always that simple.
what do you mean?
Well, while a transplant helps tremendously,
Right.
some issues can actually linger.
Really? Like, what the-
Well, it's like the orchestra's back, but some of the instruments are still a bit out of tune.
Okay, that's a good way to put it.
For example, parathyroid activity can stay high even after you've had the transplant.
So those overprotective parents are still trying to call the shots.
Exactly.
And what about those troublemakers, aluminum and beta-2 microglobulin?
Yeah, they can stick around too.
Oh no, they're really persistent.
They are.
And to make matters worse, if you have diabetes,
Ugh.
that adds a whole other layer of complexity to this whole bone health situation.
You're telling me.
So even with a transplant, there's still work to be done.
That's right.
It's not a quick fix.
Yep.
We need to keep working to fine-tune that orchestra and keep those bones and minerals in check.
Exactly.
Okay, so let's talk about this persistent hyperparathyroidism you mentioned.
All right.
What exactly is it?
Well, Basically, it means your parathyroid hormone levels stay high even after the transplant.
Even with a new kidney.
Yeah, and here's the crazy part. It can affect a lot of people.
Like how many?
We're talking 30 to 50% of transplant recipients.
Wow, I had no idea it was that common.
It's a bigger problem than a lot of people realize.
So why does it happen?
Well, remember how I said those parathyroid glands work overtime during dialysis?
Hmm.
Well, all that hard work makes them get bigger.
Oh, like they bulk up?
Exactly. And shrinking them back down to normal size, well, that takes time, like months, sometimes even years.
Oh, wow. So they've gotten used to being in charge.
It's like they've become accustomed to being the conductors and don't want to give up the baton.
Haha, they're a little too comfortable calling the shots.
And you know what else? Sometimes those glands actually change and grow in a way that makes them less responsive to the body's normal control mechanisms.
Oh, so it's not just about their size, they're also kind of going rogue.
Exactly, and that can lead to even more problems.
Like what?
Well, remember how we talked about high calcium levels?
Yeah.
That's one of them. Well, when those parathyroid glands keep pumping out too much PTH, it can cause hypercalcemia, meaning high calcium in your blood.
Right, and that can lead to a whole other set of issues.
You got it.
Okay, so managing this persistent hyperparathyroidism is clearly super important.
It really is.
But you mentioned other things that can cause calcium levels to rise after a transplant, even if those parathyroid glands are starting to behave.
Oh, yeah, for sure.
So what are some of those?
Well, remember those calcium phosphate deposits we talked about earlier?
Yeah, the ones that build up because of chronic kidney disease.
Right. Well, when they start to get reabsorbed after the transplant, they release calcium back into the bloodstream.
Oh, so it's like this sudden influx of calcium.
It can be.
Anything else?
Yep. So once you have that transplant, vitamin D starts working again.
Which is a good thing, right?
It is, for the most part, but it can also increase calcium absorption.
Oh, so another potential source of high calcium.
Exactly. And your new kidney might also hold on to more calcium than before.
So it's like this perfect storm of factors that could push calcium levels up.
Yeah, it can be tricky.
And even better nutrition after a transplant, which is a good thing overall, can play a small role too.
You're right. It all adds up.
So managing all of that seems pretty complicated.
It definitely requires careful monitoring and management, but it's essential for long-term success after a transplant.
Okay, so lots to consider when it comes to calcium.
For sure.
Now, let's switch gears and talk about aluminum for a minute.
Okay.
You mentioned it can build up in people with kidney problems.
Right.
Is that still a big concern with modern dialysis?
Thankfully, it's less common now because dialysis centers use fewer aluminum-containing products these days.
That's a relief.
But it's still something to be aware of, especially for people who are on dialysis for a long time before their transplant.
Makes sense.
But the good news is a successful transplant really helps reverse that aluminum buildup.
It's good to hear.
It is.
Now, what about phosphate?
All right, yeah.
I know it's important for bone health, but you mentioned it can actually be too low after a transplant.
Yeah, that's right.
Why would that happen?
It's kind of another one of those post-transplant paradoxes.
How's...
Your new kidney might be a little too good at its job, a little too enthusiastic about getting rid of phosphate.
Oh, so it's overcompensating after years of phosphate retention.
Exactly. It's like it's trying to make up for lost time.
So the kidneys are trying to do their job, but they're maybe going a bit overboard?
It can happen.
And what about that FGF23 molecule you mentioned earlier?
Yes, FGF23.
Does that play a role here?
Definitely. Remember, FGF23 tells the kidneys to get rid of phosphate through the urine.
Right.
Well, it can build up before the transplant because of those kidney problems, and sometimes it stays high even after the transplant.
So even with the new kidney, FGF23 is still pushing for phosphate removal.
Exactly. So in those early days after your transplant, FGF23 can definitely contribute to low phosphate levels.
So you got the new kidney getting rid of phosphate and FGF23 egging it on.
It's a double whammy.
But you said things change after about a year.
Yeah, that's right.
What happens then?
Well, after about a year, those overactive parathyroid glands we talked about earlier, they seem to become the main driver of low phosphate.
So FGF23 takes a backseat, but those parathyroid glands just keep on trucking.
Pretty much. They're determined to keep things out of balance.
It's like they have their own agenda.
Uh-huh. That's one way to put it.
And to make things even more complicated, you mentioned something about immunosuppressant drugs also potentially contributing to low phosphate levels.
You're on top of things. Yeah, some research suggests that certain immunosuppressants, particularly the ones called mTOR inhibitors, might also play a role.
Wow, it's like a tangled web of factors.
It is, and it's not fully understood yet. but it's another piece of the puzzle.
So many things can affect phosphate levels.
Definitely makes it challenging.
Why is it so important to get this right?
Well, for one thing, you need phosphate for strong bones. But low phosphate can also make you feel weak and tired, like your body just doesn't have the energy it needs.
Makes sense.
It's like your body's battery isn't fully charged.
So how do you treat low phosphate? Just take some phosphate supplements.
It's not always that straightforward, unfortunately.
Why not?
Well, if those parathyroid glands are still overactive, giving extra phosphate can actually make things worse.
Really? It's like adding fuel to the fire.
Exactly. It's a delicate balancing act, and doctors need to carefully monitor phosphate levels and adjust treatment accordingly.
Okay, so it's a lot more nuanced than I initially thought.
It is, but with careful management, it's definitely possible to keep those phosphate levels in a healthy range.
That's good to hear.
Now, what about that other troublemaker we talked about earlier, beta-2 microglobulin?
Oh, yeah. The one that can build up and cause those harmful deposits, especially in the joints.
Exactly, and that can lead to a condition called dialysis-related amyloidosis.
Right, so what happens to that after the transplant?
Well, the good news is, after a transplant, symptoms usually improve pretty quickly.
That's great.
The new kidney starts filtering out that beta-2 microglobulin,
Okay.
and your body can start clearing out those deposits.
So problem solved.
Well, almost.
There's a but coming, isn't there?
Yeah.
What is it?
While new cysts are rare after a transplant, the old ones don't usually disappear completely.
So there might be some leftover damage, even if things get much better overall.
Exactly. It's something to be aware of.
Okay, so we've talked about mineral imbalances.
Right.
We've talked about those rogue proteins.
Yep.
But now let's shift our focus to the long-term impact on bones after a transplant.
All right. Sounds good.
What are the main challenges we're looking at here?
Well, the two big ones are osteopenia, which
Yeah.
is basically weak bones, and osteonecrosis, which is much more serious. That's when the bone tissue actually dies.
Oh, wow, that sounds scary.
It can be.
And these aren't just minor issues, are they?
Not at all. They can cause some major long-term health problems.
Okay, well, let's start with osteopenia.
Okay.
What exactly does that mean?
It's kind of like a silent thief of bone health.
Oh.
Your bones lose density, which makes them weaker and more likely to fracture.
And how common is this after a transplant?
Unfortunately, it's pretty common.
Really?
Yeah, studies show that bone loss can actually start really early on, within the first few months, and it can happen fast.
Like how fast?
One study found that patients lost almost 7% of their bone mass in just 6 months.
Wow, that's a lot of bone loss in a short amount of time.
It is, and it doesn't just stop there.
Oh, no.
While the most rapid loss happens early on, it can continue at a slower pace for years.
And that increases the risk of fractures, right?
Absolutely. And not just in your spine, but even your hands, ankles, and feet can be vulnerable.
So why does this happen? Why do bones weaken after a transplant? Is it just those lingering mineral imbalances we talked about?
Well, it's a combination of things.
Like what?
Some of it is definitely leftover issues from the kidney disease itself, like those overactive parathyroid glands.
Right, those guys again.
But a big part of the problem is the medications needed to prevent rejection,
Oh, well.
especially glucocorticoids, which are basically steroids.
Steroids, essential but not always so friendly.
They're a double-edged sword.
How so?
On one hand, they're amazing at suppressing the immune system and helping to prevent your body from rejecting that new kidney.
Right, that's the whole point.
But on the other hand, they can really mess with your bone health.
So how do steroids actually harm bones?
Well, they have a couple of sneaky ways of doing it.
Tell more.
First, they directly harm those cells that are responsible for building new bone, called osteoblasts.
Oh, no. So they're slowing down the whole construction crew?
Exactly. And second, steroids actually increase the activity of cells that break down bone, called osteoclasts.
It's like sending in a demolition crew at the same time.
Ha! Yeah, it's a recipe for disaster.
And on top of all that, they mess with calcium absorption, affect hormones, and just generally create an environment where bones struggle to stay healthy.
It's like they're attacking bone health from all angles, making it harder for your body to keep up with repairs.
So it's this multi-pronged attack on your skeletal system.
Yeah, it can be tough.
You mentioned earlier that the role of those overactive parathyroid glands isn't fully understood in all this.
That's right.
What do we know about how they might be contributing to the problem?
Well, we need more research for sure, but some experts think that pre-existing hyperparathyroidism might lead to too much loss of cancellous bone.
Cancellous bone.
Yeah, that's the spongy inner part of the bone.
Oh, so it's like they're targeting the softer, more vulnerable part of the bone structure.
So that's the thinking, yeah.
So you've got the steroids doing their damage, and possibly those parathyroid glands adding to the problem.
Bit complicated picture.
And then there's cyclosporine, another immunosuppressant you mentioned earlier. Does that affect bone health too?
There's some evidence that it might contribute to bone loss, especially in the long term or if it's used without steroids.
So another potential culprit.
Yeah, but the research on cyclosporine and bone health is still ongoing, so more to learn there.
Sounds like preventing bone loss after a transplant is really important.
It's absolutely crucial.
But with all these factors working against you, is there anything you can actually do?
Yes, definitely. There are steps you can take to protect your bones, and that's what we're going to get into next.
Oh, good, because this is starting to sound a little bleak.
I know, but don't worry. We're going to talk about all the things you can do to keep your bones strong and healthy after a transplant.
Okay, I'm ready for some good news.
Let's get to it. Absolutely. There are definitely things you can do. It's not a lost cause.
Okay, good.
The key is to be proactive
Right.
and work with your doctor to really manage these risks.
So there's hope.
There is, for sure.
So what are some strategies for preventing bone loss after a transplant?
Well, the first thing is to try and minimize steroid use as much as possible.
Yeah, those steroids, we got to keep them in check.
Exactly. But it's a delicate balance, right? Because you need enough to prevent rejection.
Right, of course.
So doctors aim for the lowest effective dose, basically trying to walk that tightrope between preventing rejection and minimizing those side effects.
It's all about finding that sweet spot.
You got it.
So minimizing steroids, that's number one.
And then there's calcium and vitamin D supplements.
Oh, yeah. Those are essential.
They are the building blocks for strong bones.
Right.
And a lot of transplant recipients need extra support in these areas.
Makes sense. But, we talked earlier about vitamin D increasing calcium levels.
Oh, yeah. Good point.
Is that something to be concerned about?
It can be, definitely.
So we need to be careful.
Yeah. Vitamin D needs to be monitored carefully, especially if those parathyroid glands are still acting up.
Right. They can't catch a break.
Exactly. Too much vitamin D could lead to high calcium levels.
We don't want that.
Nope. It's all about finding that right balance for each individual.
So personalized medicine,
That's the future.
it's not one size fits all.
Nope. Everybody's different.
Now, what about other medications? Are there drugs specifically for protecting bones?
Oh, yeah, there are.
Like what?
Well, bisphosphonates are a class of drugs that are commonly used to slow down bone loss.
Okay.
And they've shown some really good results in studies of transplant patients.
So that's promising.
It is. And calcitonin is another option, often used for patients who are at high risk of bone loss.
Interesting. I've also heard about some medications for osteoporosis that actually help build bone.
Oh, yeah, those are cool.
Could those be helpful after a transplant?
That's a great question, and it's definitely an area of active research.
So there's hope on the horizon?
There is. One of those medications is called teriparatide.
Okay.
It's a bone-building agent that's shown a lot of promise in other types of osteoporosis.
So it's got to be helpful for transplant patients too, right?
Well, we need more research to know for sure how well it works specifically for transplant patients.
Makes sense. Got to test it out.
But it's definitely something to keep an eye on.
So there are a lot of options being explored.
Yeah, lots of research going on, which is encouraging.
What about lifestyle changes? Can those make a difference?
Oh, absolutely. Weight-bearing exercise is super important for bone health.
Yeah. You got to keep those bones active.
Exactly. It stimulates bone growth and helps keep your bones nice and strong.
So hit the gym.
Well, it doesn't have to be the gym. Just talk to your doctor about what type of exercise is safe and appropriate for you.
Right, because everyone's different.
Exactly. But even things like walking, dancing, even gardening, it all counts.
Oh, that's good to know. I like gardening.
And don't forget about a healthy lifestyle overall. Things like eating a balanced diet, getting enough sleep, managing stress.
Right, it's all connected.
It all contributes to good bone health.
So it's not just about taking medications.
It's bigger than that.
It's about making healthy choices in all areas of your life.
You got it. It's about taking control of your health.
Being an active participant.
That's the key.
Okay, we've covered a lot, from the challenges to the reasons for hope.
It's been a journey.
What's the one key takeaway you want listeners to remember about osteopenia?
I think the most important thing is that while it's common after a transplant, it's not inevitable.
Oh, that's good.
You can do something about it.
There's hope.
There is, for sure. By understanding the risks and taking those proactive steps, you can really reduce your chances of developing this condition and maintain strong, healthy bones for years to come.
That's reassuring to hear.
It is. Knowledge is power.
All right, well, on that note, let's move on to that other, more serious bone complication you mentioned earlier,
Oh, yeah.
osteonecrosis.
This one's a bit more intense.
What exactly is that?
Well, it's not just bone weakening like osteopenia,
Yeah.
it's actual bone death.
Bone death.
Yeah, it's a little freaky. Imagine a section of your bone slowly being starved of blood, like a plant without water.
Oh, wow.
The tissue just withers away.
So it's like the bone is dying from the inside out.
That's a good way to put it. Essentially, what happens is the blood supply to a section of bone gets disrupted, and the bone tissue dies.
That sounds incredibly painful.
It can be very painful.
And where does this usually happen in the body?
It often affects the long bones, especially the hip joint.
Oh, wow. That's got to be debilitating.
It can be, and sometimes it can even affect multiple joints at the same time.
Oh, no.
So what causes this lack of blood supply? Is it those mineral imbalances we talked about? Or the medications?
Yeah, what's the culprit?
Well, the exact cause is still a bit of a mystery,
Really?
but steroids are definitely a major suspect.
Ah, those steroids again.
They seem to disrupt blood flow to the bones, and that can lead to osteonecrosis.
And even though the risk has decreased over time,
Yeah, it's getting better.
it's still a serious concern.
It is, especially for folks who need high doses of steroids after their transplant.
Okay, so if steroids are the main culprit, does lowering the dose help prevent osteonecrosis?
Unfortunately, once osteonecrosis develops, reducing steroids doesn't seem to help much.
Oh, that's too bad.
Yeah, the damage is kind of already done at that point.
That's a bummer.
It is.
So how is it diagnosed and treated?
Diagnosis is usually based on symptoms like pain, limited joint movement, and it's confirmed with imaging tests.
What kind of imaging?
An MRI is the best way to catch it early,
Okay.
and treatment often involves surgery.
Oh, wow. So it's a pretty serious intervention.
It is. Sometimes early intervention with things like vascularized bone grafts or core decompression might offer better outcomes.
So there are options.
Yeah, but in a lot of cases, joint replacement surgery ends up being necessary.
That's a tough road to go down.
It is.
Are there any other bone-related issues that we should be aware of after a transplant?
You know, there's one more we should touch on.
Okay, what is it?
It's a specific type of bone pain that's been linked to cyclosporine.
Oh, that immunosuppressant.
Yep, that's the one.
And possibly tacrolimus too, right?
It's not as common as those other two, but it can be really debilitating.
So another potential side effect of these powerful medications.
It's true, they're lifesavers, but can have some downsides.
So tell me more about this cyclosporine-related bone pain.
Well, it often happens when cyclosporine levels in the blood are high.
Okay.
The pain can be severe.
Like what kind of pain?
People often describe it as deep and aching.
Ugh, that sounds awful.
Yeah, it's not fun.
And what causes it?
Well, the exact cause is still being investigated.
Another mystery.
But the leading theory is that it involves changes in the blood vessels within the bone.
So it's not just the medication itself, it's how the body reacts to it.
Exactly. It's a complex interplay of factors.
And you mentioned something earlier about specific MRI findings with this type of bone pain.
Oh, yeah, that's interesting, right?
It is. Tell me more.
When doctors do an MRI on someone with this type of pain, they often see signs of edema, meaning swelling, and sometimes even tiny fractures within the bone.
Wow, so it's like the bone is under so much stress that it's starting to break down from the inside.
It's a bit like that, yeah. Pretty intense.
So how do you treat this type of bone pain? Is it just a matter of lowering the cyclosporine dose?
Well, lowering the dose is definitely part of the solution.
Okay.
But doctors often use other medications as well, like calcium channel blockers.
What do those do?
They can help relax the blood vessels and improve blood flow to those bones.
So it's a two-pronged approach.
It often is.
And does that combination usually work?
In a lot of cases, yeah, it can really help relieve the pain.
That's good to hear.
It is.
Well, we've covered a lot of ground today.
We have. It's been quite a journey.
From the initial chaos of chronic kidney disease.
Remember those toddlers?
Yeah, I won't forget them anytime soon.
To the lingering challenges and potential complications after a successful transplant.
Right, it's not all smooth sailing.
It's definitely something that requires careful monitoring and management.
It can feel like a lot to manage.
It can, but the most important thing is to be aware of the potential issues and to work closely with your healthcare team.
Yeah, that's key.
They can help you navigate these challenges and come up with a plan that's right for you.
So personalized care.
That's the goal.
And to leave our listeners with a final thought-provoking question.
All right, hit me.
Given all these complexities of bone health after a transplant, what emerging research or treatments offer the most hope for the future?
Ooh, that's a good one. And there's a lot to be excited about. There's definitely a lot to be excited about.
Like what? Give me some hope here.
Well, there's so much cool research going on in bone health right now.
Oh, tell me more.
New medications, innovative surgical techniques, you name it.
It's like the field is exploding with possibilities.
It really is.
And as we learn more about all these factors that affect bone health after a transplant,
Right, all those intricate connections.
we can come up with better strategies to protect our bones.
Exactly. More targeted, more effective, more personalized.
It's encouraging to hear that so much is being done.
Oh, yeah. Lots of brilliant minds working on this.
It feels like we're just starting to understand the complexities of bone health after a transplant.
We're just scratching the surface.
So many unanswered questions.
So many mysteries to solve.
What are some of the big ones that researchers are grappling with right now?
Well, one of the biggest mysteries is the exact role of those overactive parathyroid glands in post-transplant bone loss.
Those little troublemakers, they're always up to something.
We know they're involved, but we don't know exactly how.
So are they the main driver or just an accomplice to those steroids?
That's what we're trying to figure out.
It's like a detective story, the case of the disappearing bone.
And there's this whole other frontier of personalized medicine.
Oh yeah, we touched on that earlier.
We're realizing that everyone's different when it comes to bone health.
Makes sense. Not everyone reacts the same way to medications or lifestyle changes.
Exactly. Some people are just genetically predisposed to bone loss,
Right, it's in their genes.
while others might have certain lifestyle factors that increase their risk.
So how do we move from this one-size-fits-all approach to something more tailored and effective?
Well, that's the million-dollar question, isn't it?
It seems like the future of medicine.
Researchers are working on developing better tools to assess individual risk factors,
Oh, that's cool.
so we can predict who's most likely to develop bone problems after a transplant.
Imagine a world where you get a transplant and your doctor can say, okay, based on your unique profile, here's exactly what we need to do to protect your bones.
Wouldn't that be amazing?
It would revolutionize post-transplant care.
And beyond just identifying those risk factors, the goal is to develop truly personalized treatment plans.
So instead of just a blanket approach, you get something specific to your needs.
Exactly. Maybe you need a higher dose of vitamin D or a different type of exercise program.
Or maybe there's a brand new medication that's specifically designed for your genetic makeup.
That's the dream.
It's like science fiction becoming a reality.
It's getting closer every day.
What about those rogue proteins we talked about earlier?
It's like beta-2 microglobulin.
Yeah, any hope for preventing those harmful deposits from forming in the first place?
Absolutely. That's another hot area of research.
So what are scientists working on?
Well, they're looking at ways to modify those proteins.
To make them less sticky.
Exactly. Or to develop drugs that actually prevent them from clumping together and forming those harmful deposits.
So it's about getting ahead of the problem, not just reacting to it after the fact.
Prevention is key. Always better to stop those deposits from forming in the first place.
I like that proactive approach.
And on the treatment side, there's a lot of buzz about regenerative medicine.
Ooh, regenerative medicine. That sounds futuristic.
It's cutting-edge stuff. Imagine being able to actually regrow lost bone tissue.
Wow. Instead of just slowing down bone loss, you can reverse the damage.
That's the ultimate goal.
What are some of the techniques they're exploring?
Well, one really promising approach is using stem cells.
Stem cells, they can do just about anything these days.
They're amazing, and they have the potential to stimulate bone growth. Scientists are also working on bioengineered scaffolds.
What are those?
It's like creating a framework for new bone to grow on.
So you're giving the body the building blocks it needs to repair itself.
That's the idea. Pretty cool, huh?
It's amazing. It sounds like there's so much to be hopeful about.
There really is. We're making incredible progress.
And as technology continues to advance,
Oh yeah, it's moving fast.
I bet we'll see even more innovative treatments for bone health after a transplant.
I'm confident we will.
Well, this has been an incredible deep dive into the world of post-transplant bone health.
It has. We've covered a lot.
We talked about the challenges, we explored the reasons for hope,
Ups and downs, twists and turns.
and it's clear that the future is full of possibilities.
The future is bright.
Any final thoughts for our listeners before we wrap up?
You know, I think the main takeaway is this. Bone health after a transplant can be complex, but it's not something to be afraid of.
Right, knowledge is power.
Exactly. With knowledge, awareness, and a proactive approach, you can really take control of your bone health and live a long, healthy, active life after transplantation.
Beautifully said. To all our listeners out there, remember, you're not alone on this journey.
There's a whole community of support out there.
Healthcare providers, researchers, fellow transplant recipients, we're all in this together.
And we're all rooting for you.
And as always, we encourage you to stay curious, stay informed, and keep exploring the fascinating world of science and medicine.
Never stop learning.
And until next time, happy diving.